Alright, so now we'll talk about the review. The review is already posted, so you can work with it. Alright, so before we start with the review, just a quick heads up, and I will actually do an announcement later in the day. Your exam when will it start? Friday, what time? Friday at 9 a.m. and we'll close on? At 9 a.m. Now we will have 64 questions, right? And it will have 80 minutes, 80, right? So you have extra time. Make sure all the other stuff, respond is locked down, that is working before you even start. Okay. Now each chapter will have 14 questions, so means 56, and there will be a bunch with mix of everything. So there will be a mix of everything questions, and those questions will be slightly little bit level up than these other 56 questions. Make sense? Okay, so total 64 questions and 80 minutes, right? And everything will be multiple choice. I have enabled the lockdown browser, enables the calculator, just in case you need, you can use it. Otherwise, you can not a phone. If you have a manual calculator, you can use it, not phone. Okay, if you do have manual calculator, if you like want to use that, then you can use that. And but make sure when lockdown browser is checking the environment, then show that too, so that it doesn't perceive as cheating or anything. Okay, but only manual calculator, not phones. Okay, but otherwise I don't think you will actually need that much of calculator, but in case I have enabled the calculator in the browser. All right, and even if it is, you should be able to do it mental calculation like 100 minus 80, that I'm pretty sure you can do that. All right, and 1/3 of 90, something like that. Those simple calculations won't be anything complicated calculation, but in case, still it's enabled. All right, any questions before I start? All right, first question. Which anterior pituitary hormone among the following option does not target any other endocrine gland? ACTH, growth hormone, FSH, follicle stimulating, or luteinizing hormone? Which one does not target another endocrine gland? It targets another organ but not an endocrine gland. Means which is not a trophic hormone. Growth hormone. What does it target? Skeletal system, muscle system. Super. Next question. Which option oxytocin matches to? Oxytocin is released as an example of a positive feedback control system? Is oxytocin in the adenohypophyseal secretion, means anterior pituitary? Exerts its more important effect during menstruation, controls milk production, and controls metabolic rate. So which one matches with oxytocin secretion? Not D. Oxytocin doesn't control metabolism. A. It is an example of positive feedback control system. Who can remind me what is positive feedback control system? From 208. What is positive feedback? Yes. So basically, not only oxytocin, it can happen with other substances also. Once the cycle of this particular substance starts, that secretion will not stop until the work is done. For example, oxytocin is secreted when a woman is in labor. So it's going to continue to secrete oxytocin because it helps in the contractions. So it is going to secrete until the labor is done. Then it will fall back to its normal level. So that is positive feedback system. Next question. Which of the following is not a change that may be caused by hormonal stimulus? Change in membrane potential, stimulation of a genetic event resulting in protein synthesis, increase in enzyme activity, direct control of the nervous system, and opening of ion channels, which is not caused by hormonal stimulus. D, opening of an ion channel. It's a simple cellular mechanism. It will only open when there is a concentration difference of ion. Remember active passive transport? Yeah. D. I'm sorry, E, not D. E. Opening of an ion channel. All right. Next one. Which of the following molecules act as a second messenger? I think we did discuss this in class. D. All of the above, CAMP, calcium, IP3, all of these are second messengers. Okay. Receptors for steroid hormones are commonly located where? For steroid hormones, not the amino acid ones. A. Inside the target cell. So these steroid hormones do travel inside the cell. For amino acid hormone, that is not the case. It stays on the receptor and then on the cell membrane and attaches with its receptor, and then all the second messenger system works after that. Okay. Number 6. A patient is displaying we also discussed this in class, high volumes of urine output and severe dehydration. The most likely cause is C. Hyposecretion of ADH. Which of the following is an indirect effect of PTH? Not directly, but indirect effect of PTH. Increase in calcium absorption in the intestine indirectly. Partly C is also true, increasing calcium reabsorption in the kidney, but kidney tubules actually. So partly B is more appropriate, but C is also true. So B and C, I would go for both. But because increasing osteoclast activity or activating vitamin D is much more direct effect. Okay. Which of the following is not an action of glucagon? Glucagon is the hormone that does the opposite thing of insulin. What is that? B, yes, because hormone do not transport its own target substance. So therefore, glucagon will not transport glucose into most body cells. Glucagon will actually can help in breaking down of glycogen, forming glucose. So that is a direct action. It also will help in synthesis of glucose from lactic acid when we are low in glucose. Also release of glucose to the blood by liver cells, because liver is where glycogen is stored. So all this glucagon can do, but it is not going to transport the glucose itself. Okay, who is going to transport it? Who is the transporter of your body system? What is that? Blood. So blood will transport it. Which hormone is produced in hypothalamus? A. ADH. The both posterior pituitary hormone, ADH and oxytocin, they are produced in hypothalamus. And where are they stored? Posterior pituitary. From there it is released when needed. All right. Number 10. Occasionally, a female patient will experience hirsutism, or which is basically excessive facial hair growth. However, the blood test revealed that her testosterone level is normal, because females also have testosterone, but that is normal. Which another hormone can cause this? Hypersecretion, of course. And also, you will give me a specific example of that hormone. Really? Yes.
Is it D?
Why do you think so?
The androgens?
Because the other ones like mineralocorticoid, glucocorticoid, these are nothing to do. It's related to facial hair growth. So it is related to testosterone. Facial hair growth means it's related to sexual reproduction or sexual hormones. So mineralocorticoid, glucocorticoid, catecholamines is nothing to do with sex hormones. The only one that will be related to is gonadocorticoid, right? Now the specific one is the androgen that can cause facial hair growth in females. All right, any questions so far? All right. Red blood cells are efficient oxygen transporter of cells of the following characteristic, which is a major contributor for oxygen carrying capacity of red blood cells. This is easy. C, biconcave disc. You can expect this kind of questions in the exam, which is directly asking about the function of WBC, RBC or platelets. These cells are important in fighting parasitic infection. Which one is it? B, eosinophil. Each hemoglobin can carry how many oxygen atom? 4. If it's 4, that means what is the oxygen saturation of that molecule? 100%. As it goes down, the saturation level also goes down. For example, if there is only 2, then it will be 50% saturated. Okay. A hematopoietic stem cell gives rise to which of these cells? A hematopoietic stem cell. All of the above. Hematopoietic stem cells actually gives rise to erythrocytes, leukocytes and platelets, both. They have their own pathways, but the actual cell, the actual stem cell is the hematopoietic stem cells. All right. An elevated neutrophil count, what will it indicate? It says easy one. C, acute bacterial infection. Antihistamines counter the action of which white blood cell? Basophil. Super. Okay, think about this thing before answering this question. Which agglutinin are naturally present in someone who is B positive blood group? Agglutinin is the antigen or antibody? Antibody. Antigen is agglutinogen. So it is asking about a B positive person will have what kind of antibody? Anti-A. So this is a B positive person, so the antigen will be B, right? And of course will have also Rh positive. And now the antibody this person will have is anti-A. So can you give A blood group to this person? No. And that is true for vice versa. Normal heart sounds are caused by which of the following events? B. So there are 2 heart sounds we hear, and that's because of the closure of the heart valves. We have another question following up, which actually specifically says which one actually creates what kind of sound. All right. Of the following layer of the heart wall, which actually consume the most energy, and you will tell me then why. Consumes most energy and why? Which one? B, myocardium. That is right, but why? That is the muscle cell that contracts really. Epicardium, endocardium, pericardium doesn't really contract, right? So epicardium is a part of pericardium only. Endocardium is the inner lining, and myocardium is the thick wall that is made up of these cardiac muscle cells that actually really contract. So that consumes the most energy. Which of the following structures is an exception to the general principle of surrounding blood vessels oxygenation level? This is also an easy one. D, both A and C. So pulmonary artery carries deoxygenated blood, veins carry oxygenated blood. Apex of the heart points towards left hip or right hip? Left hip. Okay. The plateau portion of the action potential in the contractile cardiac muscle cell is due to what? The plateau portion in the contractile cardiac muscle cells. Influx of calcium ions. Calcium ions does not cause tetany. It does not stiffen, but just holds the action potential for a little bit. So influx of calcium ions. Cardiac output, CO, is determined by heart rate times stroke volume. So cardiac output means heart rate times stroke volume. What is cardiac output? How would you define it? And what's the unit? Cardiac output. So think about the term and tell me what is it and what would be the unit. What is that? That's so, yeah, that I know, but what is it? How would you define it? If I tell you the unit of cardiac output is ml per minute, then how will you say that? Like, what is cardiac output really then? Yes, the amount of blood that is coming out in one full cardiac cycle. Amount of blood that is coming out of the heart after finishing one full cardiac cycle. That is our total cardiac output. And that obviously when the heart rate is changing, it's going to change. Basically that is the beats per minute, and stroke volume is ml per minute. So how much is in per unit time, how much blood is coming out, and that together gives us the total cardiac output. Which heart abnormality has no P waves, which otherwise we see that in a normal ECG? No P waves. Junctional rhythm, no P waves. Yep. Okay, here you go. The sound question again. Lub-dub sound. The lub-dub heart sounds are produced by what? There's two specific sound. One is lub, one is dub. Lub is caused by one set of valve. Dub is caused by another set of valve. C. The closing of AV valve means the lub, and then the closing of the semilunar valves is the dub. These structures prevent the prolapse of atrioventricular valves. AV valves, tricuspid, bicuspid. Chordae tendineae. It's the cord that keeps the valve open. Whenever blood has flown, then releases, then the valve is closed. So it basically prevents the prolapse of the AV valves. Atrial repolarization during this period of time is seen on an ECG. Atrial repolarization. Sorry. Atrial repolarization occurs during this period of time seen on an ECG. Which one? C is nothing to do with atrium. P wave, atrial repolarization. The entire ventricular myocardium, remember in talking about the entire ventricular myocardium, remains depolarized during this phase. So P, Q, R, S, T, it will be depolarized during this phase or during this time on an ECG. Completely depolarized means basically the ST segment remains depolarized. This is when the isovolumetric contraction will also happen. QRS complex is still dwindling between repolarization, depolarization. Yeah, this is a ST segment. All 4 valves are closed during this time. D, isovolumetric contraction, means the volume in the ventricles are completely constant. Awesome. Amount of blood pumped out of each ventricle in 1 minute is amount of blood pumped out of each ventricle in 1 minute is the think about it a little bit. It's talking about the blood pumped out, not about the beating. Stroke volume or cardiac output? Has to be these two. Cardiac output. Of the following cardiovascular components, which contains the majority of the body's blood volume at any one time? Systemic veins and venules. Why? Because veins are the reservoirs of blood. 60% of blood is reserved in veins. Deoxygenated blood from the myocardium enters the right atrium through see the question, not CD. Deoxygenated blood from the myocardium, means from the heart, enters the right atrium. Coronary sinus. Remember we spoke, it's not the vena cava. Remember the coronary circulation has coronary arteries, coronary veins. Now the coronary arteries connect to the aorta, but the veins do not connect to the vena cava. They open up to coronary sinus that directly drains into right atrium. So heart has got its own circulation. That is coronary sinus. Myocardium means it's talking about the heart muscles. Okay, we just got couple more. Blood drained from the digestive organs empties into what before going to the liver? Hepatic portal vein, right. This is the muscular layer of blood vessels. This should be easy one. Tunica media. Which blood vessel has thickest tunica media? Artery, veins or capillaries? Arteries. If you have a blood pressure of 110 by 80, what is your pulse pressure? 30. How did you do it? Systole minus diastole pressure, that is the pulse pressure. So 100, systole is the highest pressure always when the aorta is contracting. So 110, and then 80 is the diastole pressure. So it's a lower one. So 100 minus 80, 30. The renin-angiotensin mechanism stimulates the release of which hormone from the adrenal cortex? Aldosterone. Aldosterone. Last one should be easy. Which of the following is not a branch from the aorta? B. Right common carotid artery. Okay, which is on the right side, which is the direct branch from the aorta? On the right side. Brachiocephalic. You got it. All right. So good luck. The test will open up automatically. Test your lockdown browser and everything before actually anything starts. Okay. And one more thing before you go. One more thing. If just in case, which might happen, I'm not saying it will happen. In case your system has any problem, computer gives you any trouble, there's only one attempt to the exam and you run out of the attempt. Do not panic. Email me and I'll get back to you as soon as possible and I'll try to fix that issue. Unless your computer has problem, if I can fix that issue, then I will fix it. But do not panic. It might take me slight time to get back to you. Especially if you're emailing me at midnight, it might take some time. Okay?